Hi, Christy here. I'm going to go over some core in-office whitening instructions and setup. So first of all, I'm going to direct you and show you the setup here. First we have the kit. This is the Core Max Chairside Whitening Gel. Comes with 3 sessions, which is a total of 9 syringes. And you're going to use 3 syringes, A, B, and C, for 1 session of 20 minutes, 3 for the next 20, and 3 for the next 20. And it comes with the black plastic applicators. You also want plenty of gauze. I usually use 3 pieces of gauze for the first session, second session, and third session. Always have a basic setup, your cheek protectors, the patient's glasses, the core desensitizer, along with some Q-tips. And also this is the blockout. This is the core dental dam, and I think we have core and a different brand usually in the refrigerator, but this is the most important thing right here, the blockout, the dam, and the curing light to cure the dental dam. And then you also want to have your surgical suction ready, and then also your air and water tip. This is important. The patient needs to sign a release so that we can take before and after pictures of their shade of their teeth. You also want a shade guide handy and some vitamin E capsules. That's for areas on the gum tissue if there's any burn marks. Some lip ointment, basically just Vaseline, and a nice stack of gauze. Also make sure you have your camera or the intraoral camera to record the shade. Okay, so the first thing we want to do is we want to apply the Vaseline on the lips, and especially getting in the corners so that there's no trauma to the lips when we put the lip retractors. Now this is kind of a little uncomfortable, just putting the lip retractors on. Okay, how does that feel? Okay, go ahead and bite down just a little bit. Okay, just making sure that the lip retractors are in there securely. Then we're going to take one gauze and we're going to fold it and tri-fold it, and we're going to tuck it in the lower vestibule. Like that.
I think that upper left side might slip out a little bit, the lip.
Okay.
I mean upper right, sorry. There you go. Perfect.
Okay. Then we're going to take another gauze, again rolling it, folding it, and we're going to tuck it in the upper vestibule. Always making sure you ask the patient if they're comfortable and okay. They're going to give a thumbs up for yes, thumbs down for no. Then we're going to take another gauze and we're going to put this in the cheek area. Lots of gauze here. This one I like to open up all the way and then tuck it right in the cheek. And I also like to take one and tuck it under the retractor so it covers the lip. Just like that. Same thing on the top. Making sure you can breathe. There we go. Okay, next is the dental dam. This isolates the gum tissue so that the gel does not get on the gums at all. So you want to follow the edge of the tooth, making sure you don't put too much on the tooth as well. And this one I do about 2 to 3 teeth at one time first. I also like to get it on the bottom gauze so that the gauze stays pulled away from the lips and the teeth. And you're just going to wave it along. It hardens pretty quick. And I go as far back as the second premolar. Okay, same thing on the top. You always want to make sure you cover the distal of the first premolar, so trying to go back to the second premolar, depending on their smile line. Making sure you get right in between the teeth, covering the papilla. And if you're right-handed and you're standing on the right side of the patient, make sure you come to the left side, making sure you don't see any pink at all. If you do, you need to cover up those areas. Sometimes you may need to come in and use this saliva injector. Look like all the pink's covered. Okay. So we have a second set of eyes in here.
A little bit on the distal of the canine.
Okay.
And then let me check the other side. Maybe a little on the margin of 7.
Okay. Sorry, it's okay. I'm going to put it in your pocket. So we're covered up.
Looks good.
That's why they make it green or blue. Okay. After you're done isolating, we're going to mix the gel. Down here. So we are going to unscrew A first and B. We're going to screw those in together and transfer B, A into B. Unscrew that. We're going to take C, screw those in together, and transfer B into C. And we're going to go back and forth. Here, I usually count to 50. And you end up in C. And we're going to place the applicator tip. Okay. One more thing is we're going to take a couple of gauze and we're going to put them in the tongue area. Do you need the light? So we're applying the gel, just a small thickness in the front of the teeth, making sure to get right at the top of the barrier to the edge of the tooth. Make sure you're really careful with the gel and apply very slowly. Okay, once you're done with the gel, you want to make sure you tell the patient we're going to start 20 minutes from now. And if you have any sensitivity, I'll be checking on you every 3 to 4 minutes. I'm going to put the suction right here so they take out the saliva, okay? And try not to move your tongue. I'm going to sit you up just a little bit. There we go. You comfortable right there? And you can close down just a little bit more. Close your jaw down there. You can? Okay. That's fine. Okay, just right there, okay? Can you see me here? And then on the computer, you're going to go ahead and start with 20 minutes. I And you want to make sure you check on the patient every few minutes, making sure they're doing okay. Ask if they can't talk, so they can do yes, thumbs up for yes, thumbs down for no. This means stop. You doing okay? You can hit stop on the video. So now what you want to do is you want to suction the gel with a surgical suction and go on each tooth at a time. Taking off all the gel, making sure you don't touch the dam to move it out of place. You look really good even just after one. So good. Then we take 2 wet gauze, and you can take one and you're going to clean off the top teeth and throw this one away. Then go to the bottom, same thing. Clean off the bottom teeth with the gel, toss that one, and then take a dry gauze. Usually what I do is kind of wrap my finger around it, and you want to dry off each individual tooth. Doing okay? Okay, a little bit. Sensitive to mine? Afterwards, we're going to take out the wet gauze underneath the tongue. Do a little bit of suction. And replace the gauze around the tongue. Go ahead and bite down just a little bit more. There we go. And then you're ready for your second application. You okay? You're okay? No, just one. That's it? Okay. Face that way a little bit. Okay, after we're done, we'll go ahead and remove the gauze. And leave you want to leave the retractors on. Okay, and you want to give a little bit of a rinse here. Maybe a little cold with him. And you want to make sure you give a good rinse around the back side, making sure there's no residual gel anywhere in the cheek. Close down just a little bit. Close down just a little bit. There you go. And if you see any white spots on the gums at all, what you want to do is take a little bit of the vitamin E, rub it on a Q-tip, and dab it on the areas that you see any white gums. Now, before you take the retractors off, we want to do a photo of after. You want to hold this? All right, you got even wider than you want. and take an after picture. Perfect. Okay. Very good. I'm going to take these retractors off. Okay, and we'll go to suction. And close down together. Doing okay? A little bit of stuff in there. And close down together. Turn towards the mirror. Just smile for me. There we go. You can turn it off. I just wanted to make sure for the core whitening, you all have this sheet, and it divides it into Core Home, Core Max, Core Ultra, and Core Ultra T. And if you don't have this sheet, let me know and I can get it to you. The Core Home is going to come in this bag, and in this bag is an instruction sheet which has home videos. So I explained to the patient that they could log in and watch the videos. It comes with a desensitizer kit, which they can use to apply and make sure that if their teeth are sensitive, they can use this. And also you want to make sure that their trays fit. So they come in here, have them try on their trays, and then also comes with 2 tubes of the whitening gel, which is to be used at night. Make sure you have the Core dam. It's either the Core dam, the light curing dam, which isolates the gums, or you can have the light cure prime dent block out. That works good too. So just make sure you have this on hand. For the Core Max, when you place your order, and I'll show you how to do that, but your Core Max should come like this, and there's 3 applications in there. When you get it in, make sure you write the patient's name on there and date, and put that in the fridge, and make sure you use it only for that patient.
Okay, so when you get to this screen after you finished your scan, you're gonna go to the connect button. You'll wait for this to load up. Password should be saved already. It's gonna take its time. You'll log in. Probably just fast forward through that, right? And then from here, you're gonna click enter order data. You wanna make sure that anonymize is never clicked. They should never be anonymized. We'll mark that our patient is female, and we're gonna send it to Core Labs. So we'll click on Core. We'll give them 2 weeks, and we'll put it at 7 a.m. And then you're gonna come all the way down here to additional instructions of purchaser. You'll click in here. This will bring up this keyboard, and you're gonna type in, please fabricate, trays for Core at home whitening. Now you want to make sure that you're designating whether it's Max or what system you're using. Add that to whatever you're putting in. Please follow the lab RX instructions that Christy has created. Now, what's really important at this point is that you need to designate which office Core is going to send this case to. So whether it's going to Copper Canyon or to Sandia Park, and you can't just put please send to Copper Canyon. You need to write out the full address of whatever office it's going to. After you type that in, then you would hit add to cart. And then you would hit submit cart. Now, if you don't hit submit cart, this case is not sent to the lab. It's just gonna sit on this screen here.
After the scan is sent to Core, Core will call you and let you know that they did get the scan and confirm that the scan is good, and they'll start processing your order. Now, it's important to call Core and make sure that you let them know that you need to order the Core Home kit, which comes with the whitening gel, or the core with the Max, and then they'll send the Max gel. Usually it's the card on file that they have, and make sure that you give them the name, and it's going to either Copper Canyon or Sandia Park. After it's sent and you've ordered the product, we then write the patient's name here, what type of whitening, whether it's Core Home or Core Max, when the scan was sent, when their next appointment is, and whether it's not delivered or the appointment is complete. Please let me know if you have any questions. Again, I'm always here ready to help.